Okay, got it. Um, Four Seasons is our hospice provider, but there's so much more. And they're here this morning to talk with us about what services they offer. A reminder to put your monitor on mute if you're not talking. We will accept questions at the end of the discussion, and we will start with Shannon, perhaps. Would you like to start, Shannon?
Sure, I'll introduce myself. I'm Shannon Mullis. I'm the Regional Director of Clinical Services for the team that serves the campus at Deerfield. I've been with Four Seasons about 15 years, and it is such a privilege to have Macon on our team working with us to develop relationships. So we have a couple of presenters lined up. We have multiple service lines available to serve you, your loved ones, your friends. And so we're going to hit on all of those with the main focus being our hospice program. And then we'll have some time for questions. I really appreciate your time this morning.
This is Macon. Hi, everyone. I know some of you, and some of you I don't know yet, but just to introduce myself, I am the community nurse liaison for Four Seasons at Deerfield. I'm also the hospice case manager here. I have been on the Deerfield campus now for a little over 12 years. Started my nursing career here. I was a CNA here while I was in nursing school and was fortunate to be a recipient of the Danny Boone Scholarship, which put me through nursing school, and I'm very grateful for that. And about 6 months ago, I joined the Four Seasons team. I've been the hospice nurse here for a little over 8 years now. And Four Seasons has been a wonderful, wonderful partner for us here. So we're going to talk about a few different Four Seasons services available at Deerfield, and we're going to let the specialists in each service line talk. So we'll start with a little bit of information from Paige about our foundation and research. Then we'll move on to Maureen about care navigation.
This is a presentation
and palliative care available here at Deerfield. And then I will round it out talking about hospice and bereavement programs available as well. So I'm going to hand it over to Paige.
Well, good morning, everyone. I'm so happy to be able to join you today for this Zoom presentation and to give you some more information about Four Seasons and our work in the community. We are a nonprofit, and we have been providing care in our community for over 40 years. So we are thrilled to be your hospice provider. But we're also very happy to share with you today more information about our other service lines so that might be able to help you and your family sooner. We also have volunteer opportunities for you. We have a home store that's just down the road from you on Long Shoals Road, and we always want volunteers. We know that is something very important to keeping people active and involved and engaged. And so we encourage those opportunities for volunteers to participate in whatever you want to do. We have, again, the home stores, but there's also involvement with different committees. We on our Veterans Committee. We really want to support our veterans, and I'm sure many of you are veterans. So thank you for your service. And please know that we have special opportunities for our veterans to be recognized. We also care for children in our community. We have a very special service line called Compass, which is our grief services program that helps children, whether they've lost a grandparent, a parent, a sibling, a classmate. And that's a very important cornerstone for us as we're getting ready to launch a pediatric care line so that will help children with serious illnesses in our community. So as a nonprofit, we do raise money. My job is executive director of the Four Seasons Foundation, and I'm also the chief development officer for Four Seasons. And what that means is I am working for community outreach to engage you all in various ways, to provide the marketing services that help us to get into all of our communities and to support all the wonderful people from Four Seasons in their work every day. And it is such an honor to be a part of Four Seasons. My father was in Four Seasons care, and I wish that we had had Four Seasons care sooner in his serious illness. So that's a message that I really want you to hear, as if you've had a serious illness, that you've been diagnosed with, or if you have a loved one that has been, or that you're in a chronic illness phase, we have opportunities to help you, and you're going to learn about that. And as a nonprofit, we raise funds to help in the various ways that we provide care. We will never turn anyone away for lack of funds, whether you don't have insurance or Medicaid or Medicare, or simply just don't have the means for our home care. That is our mission, is to raise money to make sure we care for each individual in our community, to meet them where they are, whether you're living at Deerfield, you're living in a home someplace else, or for those members of our community who may be homeless. We do care very much for our community. And as a community provider, we raise those funds. And so you may receive information from us, solicitations for support throughout the year. Our Lifelines is a publication that we send out that gives information about each of our service lines and about what we're doing in our community. So we will have an opportunity for you to sign up for more information from us. No obligation to support, but we do want to keep you informed. And then also just to know that we are a trusted resource. If we can ever guide you in a particular direction, Maureen Williams is going to give you more information about that. But please know that we care very much for our Deerfield community. We want to be a good community partner. And I look forward to having opportunities to serve alongside you. I want to invite you to something that's important to us. Is our Tree of Lights. It is our community celebration of hope and memorial for loved ones who have passed. And that will be on December the 10th. It's downtown Hendersonville. And it is a way that we can celebrate memories. And we're going to also have this online. So we'll make sure that you at Deerfield know how to be able to join us for a live stream if you can't enjoy the event in person. But that is a way to remember those loved ones have gone before you. So thank you for letting me share this time with you, and I look forward to being with you again and answering any questions you may have. So thank you.
Thank you so much, Paige. We're going to turn it over now to Maureen to talk about some more of our service lines.
Thank you all. Good morning, everyone. I'm Maureen Williams. I'm the Director of Care Navigation for Four Seasons, and I'm also a registered nurse. I'm part of a team of two of us right now with the whole bench strength of Four Seasons behind us that provide private care navigation services, or some of you may have heard of it as care management or geriatric care management. And that's what we do. So I'm going to be going over that service line, a little bit about our home care service line, a little bit about our palliative care service line. So I'm just going to give you an overview of each of those. Care navigation was created because many people call us and say, my mom lives there in Deerfield and she's all by herself, and I'm in California, and can you help her make sure she's safe, make sure she gets to doctor's appointments, et cetera, et cetera. So because we got lots of phone calls like that, we birthed this service line to be able to walk alongside and support clients and families through living well and aging well and getting the right care at the right time. And so what do? We help people navigate healthcare. And to be honest, those of us who work in healthcare, it's confusing to us, right? We help you peel that back and help you navigate through your healthcare, be it accompanying you to medical appointments, making sure providers are all coordinated in the care that is being provided to you and the appointments that you're under, making sure family members know what they need to know, because you want to make sure that all the questions are asked and all the questions are answered. Lots of information. We'll share that around with people. We also help people with life transitions. Now, you all have already made a very wise, very calculated decision to be living on the Deerfield campus. You know, you've committed to being in a life care community for a reason, and not everybody has made that commitment, and they have different other life transitions for those living in the community. And so we help people with those kinds of decisions, like, is it time to downsize? Is it time to move into a place like Deerfield? Is it time to move to a different level of care in a community like Deerfield, etc.? So we help people with those life transitions. And that also includes, do you need additional assistance in the home? Maybe you need to add on some additional services in the home that maybe aren't necessarily offered or available where you live. So we help people with identifying that sort of information and those community resources, which we do a lot of help with people identifying what community resources exist to help me age well and live well in place. We also help a lot with advocacy, lots of advocacy. In fact, I do a Facebook Live session every Monday at noon. It's called Ask a Care Navigator. If you want to go to the Four Seasons, the Care You Trust Facebook page. And this past Monday, the issue was advocacy and how we help advocate on behalf of our clients. And I've already referenced one of those ways, which is accompanying people to medical appointments. Sometimes it's just helpful to have that clinical objective third party present to write out all the answers to all the questions. And finally, we definitely help people to educate on their options, but we accept their choices because it's your life. We want you to live it well. And maybe it just may be that people need care navigation services to gather information and present you with the options, and we'll accept your choices. And because care navigation is a part of a much larger organization of Four Seasons, we collaborate with our service line team members across the other services we provide, for example, hospice and palliative care and home care. We are here to help for whatever the what ifs or the what might be's. We help craft good plans so people can stay in place, because you move to a community like Deerfield because you want to feel safe and secure, not just physically, but in all ways, to know that what you need is right there for you and is going to be available for you. So we're happy to work with your team members there as well. So that's care navigation services, and it's covered under, it's paid for privately. And because of our Four Seasons Foundation, we do have a fund to help those who don't have the ability to pay. So we're very fortunate. Well, another service line we have is called Four Seasons Home Care. We purchased an agency and have owned it now for about 5 years, and it's called Four Seasons Home Care. And literally it's for providing additional services for you in your home, be it for companionship, for running errands, or for more direct hands-on cares, like to have nursing assistants or other personal care providers to provide additional help or support to you in your home. So it's like many of the other home care agencies in the area, and we do have that. And they do help with all sorts of activities of daily living, with transportation, to appointments, to going to get groceries. And I know a lot of those services are available on campus, and sometimes it's just nice to have an additional layer of support. That's a lot of what we do. And it can be provided anywhere there at the Deerfield campus. The goal is to help, honestly, is to help you stay in home longer. I'm certain that most of you, if not all of you on this meeting today, want to age in place. You want to stay right where you are. And that's where the benefits of adding a home care provider, a support service, might be helpful to you. And these services are also privately paid. They're also paid for by some of your long-term care insurance policies, as well as through the Veterans Administration. And because of the generosity of donors through our Four Seasons Foundation, we are also able to provide these services regardless of ability to pay, because of Paige and her team. Thank you all very much. It's very helpful. So those two service lines can coexist. And then the third service line about which I'm going to speak is our palliative care service line. And palliative care is a medical specialty. It's very specific training goes into being able to work into palliative care. And it's a consultative service, much like you would go to see a cardiologist for a consultation or an endocrinologist for a consultation, very specific medical practice. And it's what we call provider driven. And providers are physicians, nurse practitioners, and physician's assistants. And these are people who are very trained, very highly trained in pain management, symptom management, goals of care conversations, advanced directives, really in helping you navigate this question: what's most important to you? as you're dealing with a serious illness at anywhere along the continuum of illness. It doesn't have to be hospice care. It's for if you're dealing with a serious illness like cancer, Parkinson's disease, heart failure, or stroke. Those are just some examples of how palliative care can benefit you through the expertise of the providers. And really, I like to think of it as advanced pain and symptom management and advanced comfort care. And these professionals are highly skilled in those goals of care conversations, when you really need to just lay out and understand better for yourself and for your loved ones what your wishes are for your health and your life as you age through a serious illness. Very specialized care. And it is reimbursed through Medicare Part B, through private insurances, through Medicaid, and also through private pay and through the Four Seasons Foundation. Again, regardless of ability to pay, we're very fortunate. And these services come to you. They come to your house, they come to your apartment. And that first visit, quite honestly, is about an hour, quite honestly. It's really a thorough, in-depth exploration of your goals of care and what's important to you. I mean, how awesome is that? And then they craft a care plan for you as to how often they visit. Or, excuse me, I should say the provider on campus is Stacy Rash. She's a nurse practitioner who's just wonderful, very experienced. And she was once a hospice nurse herself. So she's comfortable with these conversations. So we're very fortunate to have these three service lines available to you should the need arise. And all three of these services can coexist together. The only two services that Four Seasons provide that don't coexist together are palliative care and hospice care. And Megan's going to explain that hospice care is in its own special world. So thank you very much. Megan, why don't you share about hospice care now?
Thank you so much, Maureen. I appreciate it. So hello again, Megan here. I'm actually going to share my screen. I've got a little PowerPoint for people who are more visual learners or like to be able to read what I'm talking about. So let's see if it will let me share my screen. Let's see. Get that going. There we go. Are you guys able to see that?
Yes.
Okay, fabulous. So we're going to talk about Four Seasons Hospice Care at Deerfield. And I've tried to go through it and lay it out pretty easily. So the first question is, when does one go on hospice care? The technical answer to that is that hospice can be initiated when one's life expectancy is within that 6-month limit and the person is no longer pursuing aggressive life-extending treatment. That's a doctor's best guess. And if I'm being completely honest, Deerfield tends to skew the numbers on hospice length of stay within Western North Carolina because the care here is really good. And so sometimes it's not uncommon for us to have folks stay on hospice care for longer than that 6 months. There's certainly some myths about hospice, and we're going to talk about those as we go through. The first myth is that hospice care is really only for people who are actively dying at the very end of life. The average length of a hospice admission at Deerfield is over 7 months. And it's not uncommon for us to have folks on hospice care for a good bit longer than that, who still look on paper like they have a 6-month prognosis, but just keep on trucking, and more power to them. It's easy to, signing on for hospice does not mean that you're stuck in hospice until the very end. If you change your mind, if you decide you want to pursue aggressive treatment, it's very easy to revoke the hospice benefit to pursue more aggressive treatment. And there's also the possibility that someone can be discharged from hospice care if they stabilize or they improve to the point that they no longer appear on paper like they have a prognosis of 6 months or less. Then Medicare tells us we have to discharge them. And then if things change again and they start to decline and once again appear to have a 6-month prognosis, they can be readmitted to hospice care. We have quite a few hospice graduates walking around the Deerfield campus. So let's see. Next up, another myth, being in hospice care accelerates the death process. A lot of folks feel like once they go on hospice, they're giving up, that's the end of that, and they will die more quickly because they've signed on for hospice care. Actually, studies show that patients in hospice care tend to live longer than patients without hospice care. They have closer monitoring to take care of their symptoms as they come up, and if you're not burning energy to fight pain or nausea or shortness of breath, then you can use that energy to keep on living a little longer. There's also the fact that that people just have a sense of relief at knowing that they're focusing on their quality of life now. And sometimes that alone accelerates or extends life. We have nurses available 24 hours a day, 7 days a week to respond to any crises that come up and help people manage their symptoms at home. I think it's really important to note that the goal of hospice is neither to prolong life or to hasten death. We focus on maximizing quality of life for whatever time our patients have left. So when someone gets to a point where they say, you know, I'm no longer focused on living for as long as I can, no matter what, even if I don't feel good, I really want to focus on feeling as good as I can now that I know that my time is limited. That's when hospice comes into play. I always like to just briefly address the question of morphine because a lot of folks sort of feel like they go on hospice, hospice is going to give them morphine, and that's going to end their life. First off, morphine, when used appropriately, which we do, does not accelerate hospice patients' deaths. We only use it if indicated, and we like to say that we start low and go slow. So we only use the minimum amount needed to control symptoms. And again, a lot of folks find that they have more energy once those symptoms are controlled. And so some folks last longer, even taking morphine because they're more comfortable. Next question we have about hospice. Where is it? It's not a place. Hospice is a service, not a location. Hospice care is designed to be provided in patients' homes, wherever their homes may be. Here at Deerfield, that could be an independent living home, an assisted living apartment, or in skilled nursing. And it's not uncommon for us to follow people from one level of care, to admit someone in independent living, and then if they need a higher level of care and they choose to move to a higher level of care, we go with them. And so that gives some continuity of care through the levels of service here. Next myth. This is a hard one. A lot of folks think that when they sign on to hospice, that means that hospice will be in their home around the clock providing care for everything. And that's not what hospice is designed for. Most hospice patients live in private homes out in the community.
30 people on it.
What was that? Okay. Live in private homes out in the community with family members or caregivers taking care of them. We come in to help with symptom management, emotional support, spiritual support. We also do have CNAs who in a home care setting can come in and help with showers a couple of times a week or baths, or teach caregivers in the home how to provide hands-on care. But our CNAs are not there around the clock. We do have staff working around the clock available to answer in case of a crisis. So if someone has a symptom exacerbation in the middle of the night, they have a phone number they can call, they get a nurse on the phone, we have doctors available to get orders in place to get you whatever you need to be comfortable. The next myth, hospice means I can't go back to the hospital. Most people who sign on for hospice want to try to avoid going to the hospital. Let's be honest, for most folks, the feeling is if I've got a limited amount of time left on this planet, I don't want to spend any of it at Mission Hospital if I can help it, or any hospital. Our staff, like I said, are available to respond in any crisis. And most things we can manage at home. We won't tell you can't go to the hospital, but we sure will try to keep you from having to go to the hospital. That that being said, we have an inpatient hospice facility. We have the Elizabeth House, which is down in Flat Rock. So in cases where symptoms can't be managed at home, which is rare here at Deerfield, but if it happens, we can, instead of taking someone to the emergency room for treatment there, we can admit folks to the Elizabeth House. It is a hospice hospital that specializes in symptom management. So patients at the Elizabeth House are seen by physicians. They have nurse specialists taking care of them who the goal is to get symptoms under control, get you on a medication regimen that can be managed at home so that you can go back home. We understand that folks want to be at home. The Elizabeth House is not a long-term care facility. We have that here at Deerfield. It really is for short-term symptom management. It's designed just to get things under control and let you go home. And that is always the goal there. So why do people go on hospice? There are a lot of different reasons. The big reason is to maximize the quality of life for whatever time is left. I always like to point out that hospice is designed to be support for you and your family. Hospice is a Medicare covered service, and Medicare mandates that our clients in hospice are our patients and their families and caregivers. So we're able to provide support to your family as well. And that's a really important part of what we do. We understand that for someone to have high quality of life in their final months and eventually a good death, they need to know that all of their people are being taken care of. And so we take care of all of your people too, with emotional support. And we focus on our patients' priorities. I like to say that the rest of your life, the medical community's job is about telling you what you need to do to be healthy. This is what you need to do. These are the medications you need to take. These are the habits you need to form. This is what you shouldn't do. Hospice care is supposed to be about us asking you, what's important to you? What are your priorities? And then that's where we get our marching orders. So for some folks, it's physical comfort. Make sure I don't have any pain, no matter what. For other people, it's I want to be as alert as I can for as long as I can to interact with my family, even if that means living with some pain. Your priorities become our priorities. For some folks, it's not about the physical at all. It's about emotional support. It's about having unfinished business that they need our support to finish off. Another myth. A lot of folks feel like if they're not in pain or having really aggressive physical symptoms, then there's no reason for hospice care. But there are other things that we do. We provide spiritual support. We have chaplains who work here at Deerfield with Tanya and Lynn to provide extra spiritual support for those things that come up as people are processing. Emotional support. For me, one of the big ones is support for family, because a lot of Deerfield residents have children who live far away. And so for them to have that connection with and communication regularly with a medical team who is looking in on their parents at least weekly, but usually more often, gives them the peace of mind to know that they are connected and they know what's going on with their folks. We provide a lot of education, letting you and your family know what to expect as disease progresses, and a link between our patients and their doctors when our patients are not able to get out for physician's appointments anymore. That's a really important link. We keep that line of communication open. So the hospice team here at Deerfield and anywhere in the community, every hospice patient in a home care setting has a nurse case manager. Here at Deerfield, that's me, sort of keeping an eye on the medical side of things, becoming extra eyes and ears for the doctor to report into the doctor on what's going on with the patient and quickly respond to any medical needs that come up so before things can get out of control. We have a social worker. Our social worker who makes visits to hospice patients here at Deerfield is Krista Bishop Hallmark. She's wonderful. She is extra support, psychosocial support, in addition to Stephen or Patrick or Paige and Renee in the different levels of care here at Deerfield, adding that extra support for you and your family. For folks who are in skilled nursing, it's just extra visits. You know, even if somebody can't necessarily process and articulate what their needs are emotionally. Having the extra visits from the hospice team just for companionship can be really powerful. Our chaplain who makes visits here on campus is Colby Truesdell. And again, he is in addition to Lynn and Tanya here, and is wonderful as a pastoral care provider. He's trained in all different spiritual backgrounds. Some folks want to talk spirituality with him, and other folks don't want to talk about that at all, but just enjoy having that extra attention. We have a music therapist who makes visits here at Deerfield, Maddie Walsh. She is amazing. If you make visits in skilled nursing, you may have heard her voice coming out of rooms. Our music therapists are trained therapists who use music to provide therapy. So they can help with emotional support. They can help with processing of what's going on in people's lives. Maddie is helpful to me in that she'll go into residents' rooms in skilled nursing when there's something that might be stressful for them and help provide music while the physician is providing care. So lots of different resources there. As I said before, we have CNAs who can come in any setting here, but usually we see them in independent living and assisted living here to provide extra hands-on CNA care. We have volunteers who make visits at Deerfield, some of them for specialized needs to help with organizing something or a specific request, others just for companionship. And then our hospice physicians are available to provide orders in times of crisis and sort of keep an eye on the whole medical picture, and they consult with our patients' existing attending physicians. In skilled nursing, Dr. McLean is the attending physician for most of the patients, and our physicians consult to help with symptom management. All right, our next myth. Hospice means leaving my doctor. Referral to hospice is always initiated by the attending physician or a specialist. The referrals come from the outside physicians, although patients can self-refer to hospice as well. Hospice team members, our team, report into your regular doctor and keep in communication with them to let them know what's going on with you, so that they're not left out and wondering what's going on when you can't get to them anymore. There is the unrelated caveat, and if Stephen is available to just briefly speak to, everybody always asks, well, what if I go to skilled nursing? Can I keep my physician? Stephen, can you address that one quickly?
So what am I addressing exactly?
The question of people usually ask if they still get to keep their physician if they're on hospice and they move from independent living to skilled nursing.
Well, so when you move to skilled nursing, unless you have the care doctors across the street, they're
Blue Ridge Premier.
Blue Ridge, yeah. They do visit their patients here, but otherwise you go to Dr. McLean. That doesn't mean that you can't choose to go to the hospice physician when the time comes for hospice, but in general, you have Dr. McLean.
Yeah. As the attending, and that's a Deerfield thing separate from hospice. So
well, it's just because most of the time doctors do not like to visit the facility. Most
family practice physicians and internists aren't able to provide the regulatory visits that are required by an attending physician in skilled nursing facilities. So it's a logistics issue.
And usually long-term care residents in skilled nursing have gone to the MAHEC services already anyway.
Yeah. All right. Just wanted to make sure we hit that. Next myth. Hospice staff will replace the Deerfield staff providing care. Hospice staff are an additional layer of support on top of any Deerfield staff already providing care. So we work together with the Deerfield staff for patients in the healthcare building in skilled nursing or assisted living. The Deerfield staff remain the primary caregivers, and then the hospice staff are making visits on top of that. And again, that adds that extra layer of those of us who specialize in symptom management and care at end of life. So the how of hospice, how does one wind up in hospice? Well, hospice usually is a result of a referral from your physician to Four Seasons Hospice. It is a Medicare covered benefit. Hospice care, all of the extras that we provide to residents here at Deerfield are 100% covered by Medicare. So it's a wonderful Medicare resource. And actually folks who go on hospice care tend to save a little bit of money because once on hospice care, hospice covers any medical equipment and or medications related to that terminal prognosis and comfort care. So let's see. Next myth. I love this one. The myth is that your doctor will tell you when it's time for you to go on hospice care. Yes, the referral to hospice is based on your physician's judgment of your prognosis, but a lot of doctors, well, they're not specialists in hospice care. And so they haven't been trained on when someone meets that criteria and on really prognosticating. And a lot of them recognize that their patient is declining, but don't necessarily think hospice. So I usually encourage folks that if you know that you want to choose hospice care when you do reach that point where you have that prognosis and when you meet the eligibility criteria, have the conversation with your doctor now. Just tell them, hey, look, just put this on your radar screen. When I get to that point, I want you to tell me and I want you to make the referral to hospice. It's hard for doctors to have that conversation with folks, to broach the subject. And so if they've heard from you ahead of time that you want them to have that conversation with you, it's easier for them to start the conversation when the time is right. All right, let's see. The next myth. We all think that we'll be able to make the decision when the time comes. The reality is that more often than not here at Deerfield, that decision winds up being made by our patients' power of attorney, decision makers, when the person is incapacitated and unable to make their own decisions. In a lot of disease processes, that's the case. And so it's very important to have that conversation ahead of time with anyone who might be in the position of making decisions for you, so that they know what you want. That is a gift that you can give to your family, is to let them know ahead of time what your wishes are. It can be a hard conversation, an awkward conversation to start. But then when they make the decision, they know that they are doing what you want them to do. And that's really important. I always tell people, not just your spouse, or not just your one child who is listed as your power of attorney on your documentation, but anyone who might be involved in that conversation, because it can be hard if you've designated one child as your power of attorney, you've had that conversation with them, they make the decision to admit you to hospice care, and you have other children who didn't hear you say it. They might ask questions. So have a conversation with anybody who might be involved in that conversation later if you are not able to talk to them about it. The next myth. The myth that having hospice care means that you're giving up. Hospice is supposed to be just about a change of focus. It doesn't mean that you can't or won't be treated when things come up. If you want to take antibiotics for an infection that comes up, absolutely, we will get antibiotics ordered for you. Some people choose not to, that's fine too. But it doesn't mean not treating you. And often we wind up using medications for symptom management that can extend people's life. Because if we're going to give you something for shortness of breath to make you breathe a little easier, it might also improve your lung function, and you may live a little longer with that. So it doesn't mean that you're giving up. It means that you're shifting your focus to quality of life. Another myth that hospice will stop all of the medications when someone comes on hospice service. Generally speaking, you continue your routine, regular medications. The hospice physician, that's a good opportunity when someone comes into hospice care for us to assess their medications with their attending physician, and see if there's anything that they've been taking for years that maybe isn't doing them any good anymore. And certainly if that's the case, then we'll talk about discontinuing it just because there's no need to be taking it. We can decrease someone's pill burden, their medication burden, by focusing on the medications that are actually helping. All right. Next myth, that someone shouldn't sign on for hospice until they're ready to give up and die. Hospice is, as I said before, supposed to be about wanting to live your best life for as long as you can while accepting that your time is limited. It's about patient-directed end-of-life care. It's about you being in charge of how things go. Years ago, I heard someone say in a hospice education forum that, you know, when someone dies, they're 100% dead. So you're either 100% dead or you're 100% alive. We focus on you being 100% alive and maximizing what you get to do during that time. We also have amazing bereavement and grief services. This is support for family members after our patients die. Our bereavement services group will reach out to your family after your death, make multiple contacts over the first 13 months to connect people with resources. Sometimes it takes a while to realize that you need extra support after the death of a loved one. And so having that connection, you know, reaching out again and saying, hey, look, we're still here, allows family members to get the support they need when they need it. Our grief team offers support groups, individual support for adults. We have the Compass program for children and adolescents experiencing loss. That is a really important and powerful program. Our foundation supports Camp Heart Songs, which is a 2-day camp for kids experiencing grief after the loss of a loved one. These services are free. They're available to anyone in the community experiencing grief after the loss of a loved one, not just the families of our patients. And it is all supported by our Four Seasons Foundation. I'm really proud of the fact that we have that resource available in the community. It's very important. And those are the high points of my presentation. So I will ask if anyone has questions. You can throw them in the chat or come off of mute and ask anything you want to ask.
Macon and Shannon, there's a couple of really excellent questions in the chat. And I know you've been busy sharing, Macon, but here's the question, and you and Shannon might appreciate answering this. How large is our staff? And how many Deerfield residents are you actively serving? And thank you, Stephen, for jumping in. We're serving, I guess, about 15 to 20 residents at a time, but maybe Macon and Shannon, you'd like to address that a bit further.
Absolutely.
The staff.
So as far as the staff at Deerfield, the team that come and make visits at Deerfield, that was the team that I described before. I would imagine that Shannon and Ricky could probably address how large our overall staff is, because we cover multiple counties. So
I do, and I did mention in the chat, so we have a staff of over 400 employees. Some of those are clinical, some of those are administrative, obviously in multiple disciplines in the clinical side. In the North region, we have 60 or so, I would say. And then we divide that regional team into smaller teams that serve geographic locations. So on the team that serves Deerfield, Macon is the primary nurse, but then she can also call on additional support nurses if she needs help with things. And then, as she was saying, there's a primary music therapist, a primary social worker that we have, so that you've got a core team, and then other additional folks that you can call on as well.
And as far as the number of residents that we serve at Deerfield, it ranges from, Stephen, you were just about right on it. From 15 to 20, we have had as many as, let's see, I've had as many as 23, 24 residents on service at a time. It waxes and wanes, and we do serve residents in all levels of care here. So it's not uncommon for me to be running from skilled up to assisted and then out to independent living and then back to skilled again. And yes, the question of after death support, yes, grandchildren as well. We can connect any family members that need that support with the appropriate services.
I wonder if I might just offer an unsolicited testimonial.
Absolutely, we love those.
We had occasion to work extensively over the last year with a family member whose terminal condition we were responsible for trying to help manage. And so we worked with Four Seasons in a residential setting, in the hospital, and for a short period in Elizabeth House. Rare you get a brief in this long, this much detail that I say I couldn't find a single thing I disagree with. It was just an extraordinary service at every stage. You guys really made a difference, and we're very grateful.
Thank you so much. I really appreciate that.
Yeah, that's wonderful to hear. We certainly strive for that.
I see a hand up.
Yes, I wanted to ask a question. You implied that the only, well, I won't say the only way, the way that people become part of hospice as a patient is through their doctor. Can an individual or a spouse initiate a relationship, or does it have to be a physician?
Ooh, that's a good question. People can self-refer to hospice. They will be evaluated to determine that they do meet eligibility criteria. Ricky or Shannon, do you have anything to add to that?
Yeah, so certainly you can make a self-referral for palliative care, and you can make a self-referral for hospice, but the Medicare guidelines do require, and the regulations require, that we have to have 2 physicians certify that somebody has a terminal illness. And so that does require at least an evaluation. And we certainly have several folks that will self-refer that maybe have not seen a medical provider in many years. And then we'll try to make an evaluation with one of our, either the palliative care nurse practitioners or one of our hospice providers as well. But you certainly could reach out and say, you know, I think this member of my family may well be eligible and appropriate for hospice care.
Yeah, I think it's important to note that that I think a lot of folks think of hospice as being just for cancer patients. And many years ago, that was the primary disease process. But we admit folks to hospice for any terminal disease process. So heart disease, lung disease, kidney disease, certainly cancer is a part of it. Dementia, different dementias have criteria for prognosticating.
Any orders that are needed for hospice services, though, we will do the legwork in getting. That is not your responsibility to obtain for us. We just need very minimal information from you to start the ball rolling.
Absolutely. The fee or rate for home care, that's a question for you, Maureen.
Right, and so there's a different fee scale, you know, based on the number of hours. We're going to be going to a flat rate in January, but just like most of the home care services, it averages around $25 to $27 an hour. Our home care service has a minimum of 1 hour for a shift right now. Great question, thank you.
And I will also note that I've got some little information sheets about the different Four Seasons services that I will place in the community center in the little post office nook sort of by the bank, where folks can pick them up, and it has sort of a short, sweet description of each service line and contact information for us as well.
So further to the question about self-referral, I wanted to mention the fact that sometimes people get anxious about a referral for hospice care. You know, still as long as I've been working in this field, we still have folks that feel like as soon as their doctor might mention hospice, that they think that they're going to be reaching the end of their life in the next 2 weeks. And that is not necessarily the case. And the hospice Medicare benefit is designed for at least 6 months. For that reason, and we've all paid into our into the Medicare fund to be able to take advantage of that. But it is anxiety producing often, and so sometimes people are more willing to accept a consultation from the palliative care provider and have that really is a stepping stone almost. And so be able to gain that additional support. Palliative care is designed to be that extra layer of support for folks, and then really to be able to help work through what the goals of care and the goals for quality of life are with an individual, and really help pave the way, if you will, to be able to transition to a point where they're more able to accept hospice care. So sometimes that's an option as well. And that might mean one visit to have somebody really listen to what you're saying, or it may be several visits that, it's really about making sure that we're having those conversations that are sometimes challenging in a less threatening way, allowing you to take the time that you need to kind of work through those decisions, and then be able to provide care that is concordant or consistent with your goals. Oh, that's a good point, Maureen. I'm so sorry. I joined late because I've been in multiple meetings this morning. My name's Ricky Hooper. I am a nurse practitioner by background. I've worked with Four Seasons for about 17 years now, and I currently serve as the Chief Clinical Officer.
Any other?
I think Lynn is raising her. Lynn, okay. Are you raising your hand? Yeah.
Thank you. I have lived in Asheville for quite a while and have been part of United Way and other organizations supporting care partners. And I always thought that Care Partners was the provider for hospice in the Asheville area. So not until I came to this meeting this morning did I realize that Deerfield deals with Four Seasons and not with Care Partners. What's the relationship between the two? And, how did Deerfield decide to go with Four Seasons, and where does Care Partners fit into this whole situation?
That's a very good question.
That is a very good question.
So Deerfield has a Four Seasons. They have me here on campus full time, but Deerfield residents do have the choice of hospices. Absolutely. So it is residents' choice. And I, as far as I know, they're a good organization. The only difference is having someone based here full time.
So every individual has the choice of which hospice care provider they would like, just as they have the choice of which home health provider they would like, or which doctor they go to, or which hospital they deal with. Several years ago, you may be aware that Care Partners became part of the Mission Health System, and now, of course, that's owned by HCA. So they're part of that system. Four Seasons is an independently owned, not-for-profit organization. Care Partners provision for hospice has some slightly different services. They don't currently provide music therapy, for instance, and that our staffing ratios are just a little bit different. So we generally have about one nurse to about 14 patients. Macon is like the nurse extraordinaire and manages a few more, but again, she has additional nurses that she can call on if necessary. So, and it's really important to us as an organization that we are providing quality care, and you can certainly go online and look at some of those quality scores and research both organizations and determine who you feel most comfortable in having care provided. And sometimes, we certainly have patients that might start their hospice care journey with one organization and then switch. And so, although we're around as well, we provide care across 14 counties. Care Partners is also still located in Asheville and provide care for several counties also.
Thank you very much.
You're welcome.
I would also like to mention the perception that you have, Lynn, is very common. We not only serve those 14 counties, we have at least an office or a checkpoint office very close to all of those counties. So our local office that serves Buncombe County is actually right down on Biltmore Avenue. And then we have another checkpoint option on Long Shoals Road. So not only do we serve those counties, we have staff that live in all those counties, and we have office space available for those employees to go work through. So the staff that serves your campus is not coming from Flat Rock or Henderson County. They are all local folks as well.
Yeah.
When I run into the office for paperwork, I run into Asheville.
Yeah, for sure. The other main difference, Lynn, is that Care Partners is no longer providing community-based palliative care. So Four Seasons has made a commitment to continue that provision, and it is a thriving care provision.
Yeah, I knew there was a change when HCA bought the whole mission operation and did include Care Partners. And I must say, I've not heard subsequent to that, whether that's changed the effectiveness or quality of the care. But I do know that, I think of Care Partners as Asheville's hospice. So I've been enlightened today.
Originally, Care Partners was formed in Asheville and Four Seasons was formed down in Flat Rock, but both of them cross all of those boundaries now and serve the same, the same area here.
Yep, I remember when this was Mountain Area Hospice, and so it was just Buncombe County, and Four Seasons was Henderson County and just Henderson County. Now we've had some healthy competition to be able to spread. And Lynn, I just want to mention too, as the Four Seasons Foundation raises funds for all of our patients, we have really grown in Buncombe County, and because we are nonprofit and Care Partners no longer is, we are really working within that Buncombe County community to raise funds for hospice. We have a lot of supporters who were giving to Care Partners now give to us because they've had a great hospice experience, whether it was with Care Partners. So that helps us as we serve more people in Buncombe County.
Well, I'm going to close today. It's 11 o'clock. Time to get on with our next task. But thank you everyone for coming. We'll record this so that we can show it to other people. Appreciate all the questions and have a wonderful day.
Wonderful session. Many thanks.
Thanks.
Thank you.